Tracheal collapse in Yorkshire Terriers, understanding the risk and taking preventative measures. Are Yorkshire Terriers prone to tracheal collapse? Yorkshire Terriers are known for their small size and adorable appearance. These pint-sized pooches make great companions and are often seen as fashion accessories due to their luxurious coats and fashionable hairstyles. However, behind their charming facade, there are certain health issues that are common in this breed. One such concern is tracheal collapse. Tracheal collapse is a condition where the rings of cartilage in the trachea, or windpipe, become weak and lose their shape. This can cause the trachea to narrow, making it difficult for the dog to breathe properly. Tracheal collapse is most commonly seen in small breeds, including Yorkshire Terriers. So, are Yorkshire Terriers prone to tracheal collapse? The answer is yes. Yorkshire Terriers are one of the breeds that are genetically predisposed to tracheal collapse. Their delicate structure and small size make them more susceptible to this condition. There are several factors that can contribute to the development of tracheal collapse in Yorkshire Terriers. One of the main culprits is genetics. If a Yorkie has parents or close relatives who have had tracheal collapse, they are more likely to develop the condition themselves. This is why it is important to choose a reputable breeder who screens their breeding dogs for this condition. Another factor that can increase the risk of tracheal collapse in Yorkies is obesity. Being overweight puts extra strain on the trachea, making it more likely to collapse. It is therefore crucial to maintain a healthy weight for your Yorkie through a balanced diet and regular exercise. In addition to genetics and obesity, there are other triggers that can exacerbate the symptoms of tracheal collapse in Yorkshire Terriers. These include exposure to irritants such as smoke or dust, respiratory infections, and excessive pulling on a leash or collar. So, how can you tell if your Yorkshire Terrier has tracheal collapse? The most common signs include a honking or wheezing sound when breathing, coughing, difficulty breathing, and an intolerance to exercise. These symptoms may worsen during periods of excitement or physical exertion. If you suspect that your Yorkshire Terrier has tracheal collapse, it is important to seek veterinary care. The veterinarian will perform a physical examination and may recommend additional tests such as radiographs or tracheoscopy to confirm the diagnosis. Unfortunately, tracheal collapse is a chronic condition that cannot be cured. However, there are several treatment options available to manage the symptoms and improve the quality of life for affected dogs. These include medications to reduce inflammation and coughing, weight management to alleviate strain on the trachea, and avoiding triggers such as irritants or excessive pulling on the leash. In severe cases where conservative management is not effective, surgical intervention may be necessary. The most commonly performed surgery for tracheal collapse is called a tracheal stent placement. This involves inserting a stent into the trachea to provide support and prevent collapse. Prevention is always better than treatment, so what can you do to reduce the risk of tracheal collapse in your Yorkshire Terrier? Firstly, choose a responsible breeder who screens their breeding dogs for tracheal collapse and other genetic diseases. Secondly, maintain a healthy weight for your Yorkie through a balanced diet and regular exercise. Lastly, avoid exposing your dog to respiratory irritants and refrain from excessive pulling on the leash or collar. In conclusion, Yorkshire Terriers are indeed prone to tracheal collapse. This condition is more common in small breeds due to their delicate structure and genetics. By understanding the risk factors and taking appropriate measures, such as choosing a reputable breeder and maintaining a healthy lifestyle, you can help reduce the likelihood of your Yorkshire Terrier developing tracheal collapse. Remember to consult with a veterinarian if you suspect any breathing difficulties or unusual symptoms in your beloved Yorkie.